All right, today we're going to go over how to mix up and administer NAD home injections. So basically we have two main components. You have your sterile water, or bacteriostatic water, and you're gonna have the NAD, which comes as a dry powder. So we have to add the water and we have to reconstitute it to make it into a solution. So first of all, we're gonna take off the caps. These are gonna be sterilized underneath, so don't touch them once you've opened them. This one's a little bit trickier with the NAD. You gotta use your nail and flick it back. Trying not to touch the rubber hub underneath because that's sterile. Once we have those open, we're now ready to begin the mixing process. We're gonna take our 10 ml syringe and then we need to apply the 18 gauge needle so that we could draw up the fluid. Don't worry, this is not the needle that you'll be using to inject yourself. You'll be using small insulin needles. So you're going to attach this needle. Notice how I didn't touch the hub, keeping that sterile, and the needle is sterile too. I can puncture this directly because I haven't touched that. In the future, every time you puncture any of these rubber hubs or you use the needle to inject in your skin, you want to clean with alcohol first. So just as an example, clean that hub, inject straight in. I'm going right into the center part of that. I'm going to invert so that the needle is underneath the solution, and now I'm going to draw up 10 mLs. So you can see my technique, I'm using just one hand and I can get that black plunger to the 10 ml mark and pull it out. Now that I have the water, I can inject it into the NAD vial. Again, I'm gonna just show, for example, how to sterilize. And now I'm going to puncture right in the middle. So this is gonna draw it in because there's a negative pressure and you see it's drawing the syringe down, and now we've reconstituted it. So in order to mix it, I'm just going to gently swirl the bottle. And now we should have a particle-free clear solution that's ready to be injected. So depending on your dosing, you may be taking somewhere between 20 to 100 units of NAD each injection. This is a 50 unit syringe. So these insulin syringes are going to have units. This one, we're going to draw 50 units, so going up to that 50 mark. But everybody will have a specific protocol, so you want to make sure you confirm that before you give yourself an injection. So we're going to take off first the cap from this small syringe, and then secondly, we're going to expose the needle, which you can see is very, very tiny and super fine. So we want to be careful with the needle. Anytime we manipulate it, we could potentially make it dull. So we want to have one puncture. So again, I'm going to sterilize the top of the NAD bottle, and I'm going to put it down so that I can go straight in perpendicularly, one puncture, and then I'm going to invert it. So we need to make sure that that needle's underneath the fluid. I'm going to use my other finger to pull back, and we're going to draw up 50 units of NAD. So there's still some air in there. I'm going to just kind of draw back and forth so that the air comes out. You don't have to worry about air bubbles because this is going underneath your skin. It's not going into a vein, but we want to try to get out as much air as possible so that we know that we're getting just the medication. And you can see that that air bubble is just slowly dissipating. So we should be good. It doesn't have to be exactly 50, but something close to that. So now we have this ready to go. There's a small air bubble there, but again, I'm not worried because we're using what's called a subcutaneous injection. So I'm going to take my shirt off so I can show you how we're going to inject it. We're going to take a small area of skin here. Again, alcohol wipe to sterilize it. And once it's sterile, don't touch it. And you're going to pinch underneath the skin and you're going to go straight in and give the injection with your other finger. So now you're going to just feel a little bit of the fluid underneath the skin. Shouldn't hurt. Might get a drop of blood like that. And I like to take the same alcohol wipe and massage the area in so that way you know that it's being absorbed. Clean up any bleeding that you might have had, which should be pretty small. It should be painless. And then you're all set. So now you've done the injection, you just want to dispose of the needles, make sure that you dispose of them somewhere that's safe. You can get a sharps container at home if you'd like to do that. And then make sure that you keep the NAD refrigerated now that it's reconstituted. Before, in the dry powder form, doesn't need to be in the refrigerator, but once you've made the solution and it's reconstituted, we want to keep it in a refrigerator to avoid any damage to the molecular components of the medication. So that should be it. Good luck.